Today has been dubbed Super Surgery Saturday by a group of dedicated doctors and other medical workers. Today they gathered at San Francisco's Kaiser Permanente Hospital to provide free surgeries to 24 low-income patients. It may be a short trip from the pre-op room to operating table for Crescencia Bacchini, but it could be the start of the road back to employment. A puncture in Bacchini's ear caused her so much pain and made it so difficult for her to hear that she was forced to give up her job as a caregiver.
I'm scared and I can't afford to pay for the surgery.
With no income and no insurance, Bacchini didn't know if she could find relief. A friend had the same procedure, and it cost that friend more than $5,000.
And she's still paying for 5 years now. And she's so envious to me. I'm grateful for these doctors in this hospital for having this program. 24
patients such as Bacchini with no insurance and who live far below the poverty level received outpatient surgeries today at Kaiser Permanente Medical Center in San Francisco.
They live with pain, they live with disability, they live with a tremendous amount of discomfort because they don't have access to even the most fundamental services.
Dr. Paul HOFMANN was one of the co-founders of Operation Access, the group that partnered with Kaiser to find more than 80 medical professionals to volunteer their time and expertise today. Kaiser donated the equipment and materials.
What is magical and I think extraordinary about Operation Access is that we're able to capture the spirit and the volunteerism that's represented by clinical professionals like physicians, like nurses and others. And then with the collaboration of hospitals, we're able to provide these services without charge.
Basically a fun day for us to all come together as a team and work towards a common goal.
And that goal is bringing relief to patients such as Esperanza, a Sonoma County mother of 2 who has suffered for more than 2 years from eye pain.
What I have in my eye is like a little piece of flesh that it was bothering me a lot.
Today she too went in for surgery to relieve her pain. Dr. HOFMANN says the services the program offers are life-changing, helping people create stronger relationships with their loved ones, help them find work, and help them live pain-free.
I didn't know this program existed, and I think it's a very good thing that it's there, and I think it's very good, and it really helps.
Since Operation Access started 16 years ago, it's provided free medical services to 4,300 low-income patients. Services the group estimates were worth about $27 million.
State Senator Mark Leno was also at Kaiser this morning, where he talked to KTVU about his efforts to reform the healthcare system here in California. About 7 million Californians, he says, do not have access to health care coverage. With the country's health care crisis becoming a top priority in Washington, Leno says he's authoring a single-payer health care reform bill for California. Single-payer health care would provide universal coverage, much like Medicare. Leno says the system would save both money and time by lowering administrative costs.
Your doctor doesn't change, your hospital doesn't change, your clinic doesn't change. The only thing that changes is who actually pays for the health care, and a much more efficient way of doing it.
Getting the proposal passed, though, could be an uphill battle. Governor Schwarzenegger has twice vetoed a single-payer health care plan.